Let's take some time to talk a little bit about deep plane facelift, which is my preferred approach to facial rejuvenation surgery. Deep plane face and neck lift is basically a procedure where we're seeking to recreate the natural anatomy of the face and neck. Over time, aging occurs in different ways in patients, but generally speaking, aging occurs on both sides of the face and accumulates mostly in the neck because that's where everything kind of comes together with gravity. A deep plane face and neck lift is an approach where we make an incision in the skin first and then travel down to the fascial layer, which supports the muscles and fat and compartments of the face. We release the tension that's been developed in that layer and then lift it back up to where it belongs. We basically place the anatomy right back where it began in order to reset the clock in terms of aging in your face. Once that anatomy has been reset and redraped, we then don't pull anything. We just remove excess skin in the area that it exists around the ear and around the temples. This is important because the difference between a natural result and an unnatural result is tension. If someone pulls skin or puts tension across the skin or across the fascia in the deeper plane, that can create an unnatural, pulled, or windswept look. This is one of the main downsides to modern SMAS altering surgeries, meaning surgeries where they alter the deeper fascia without lifting it and putting it back where it belongs. By putting tension across those tissues, it can create a vector of tension or a pull that looks odd or stretches the corner of the mouth or the edges of the face. A deep plane face and neck lift allows me to reset the natural state of the fascia and the fascia around the neck as well, to deepen the jawline, to improve the cheeks and improve the midface, and to do this all without tension. One other critical thing that I do that's different in my approach to this facelift is I like to go into the neck, to go to the deeper structures, to basically get rid of extra fat that's in the deeper plane below the platysma muscle, to put the muscles back together in the midline to really tighten the neck, and to show as much of the deepness or depth that we can see just above the thyroid and the thyroid cartilage. That really allows you to have the deepest possible neckline. I then take the muscles laterally and re-inset them as well and re-drape them and attach them to a bony landmark behind the ear to really create depth in a different way. That allows me to give a vector that provides inward tension along the neckline. So you're not just doing a surgery where you're just pulling skin or lifting skin laterally, you're actually creating depth along the jawline to give a fantastic result in that area. That technique I've written a textbook chapter on and a few articles on, which are now available in the literature. This is a really special approach that combines a thought process of looking at not just removing skin, but also redraping the deeper structures, doing it without tension, and recreating a new jawline. In some patients that never even had that good of a jawline to begin with, we can create that new depth. This is my approach to facial rejuvenation surgery, and I think it's really a modern approach, it's a state-of-the-art approach, and it's different than what many other practitioners do. Why choose this over a more traditional lift? Well, again, it's more substantial, the result is more durable. In the literature that's published, it's around a 10-year time to potentially revision surgery, 10 to 15 years. And on average, it gives you about 10 to 15 years off of the way that you look now. Also, there's decreased bruising and swelling because we're not separating the skin from the deeper fascia below. This allows for much less bruising and swelling right after surgery and somewhat of a quicker downtime and recovery. That being said, all facial surgeries require a healing journey, and we'll talk about that during the consult, and we'll go over the specifics with you. But my approach, again, is a deep plane lift where we're going after a substantial improvement in what's going on in the deeper layers. We're releasing tension that's there, putting the structures back where they belong, and then removing skin without putting any tension across that tissue. This is, I think, the best possible approach to a natural result, and will give you the most natural looking result over time. So if you have more questions about this approach and the deep plane facelift, or what I do that's different in the neck and beyond, we'll set up some time to talk to you during a virtual consultation or in person about this approach.